Your patient's SpO2 is reading a perfect 98%, yet they are visibly struggling to breathe and appear confused. Many new nurses fall into the trap of relying solely on pulse oximetry to assess respiratory status. The monitor shows saturation, but it doesn't reveal the whole clinical picture. We must look beyond the screen to understand the patient's true condition.
While a pulse oximeter measures peripheral oxygen saturation, an arterial blood gas analyzes the blood's chemical composition directly. An ABG provides critical data on oxygen tension, carbon dioxide levels, and the overall pH balance. This distinction is vital because a normal SpO2 does not rule out severe CO2 retention or respiratory acidosis. Without the ABG, these life-threatening imbalances remain hidden.
When a patient is symptomatic despite a normal saturation reading, you must advocate for an ABG immediately. This diagnostic tool moves beyond simple screening to provide a complete picture of respiratory and metabolic function. Use the pulse oximeter for continuous monitoring, but rely on the ABG for definitive clinical answers. Remember, SpO2 screens for a problem, but the ABG explains it.